is where we take the belly and the chest down to the floor and actually, Hi everyone, it's Christina Martini, and here I am with some special requests on intermediate series that are therapeutic for lower back pains and the sacrum, sciatic area, and the S joints. So in the intermediate series, it's known as nerve cleansing, Nadi Shatana, and I love to use some of the postures in there to help my patients, my practitioners, and my students and clients releasing any tensions, tightness, stiffness around the S joints, the psoas, the lower back, the sciatic, and emotions, and anything that's just, really, really negative and stiff. So one of those poses that was in question was Shalabhasana, the Locust pose. So a few tips on that is, I like to lay the belly down, and again, you're going to see me with my entire top of the feet also down on the floor, and just resting the head for now, the tip of the nose down on the floor, your hands about rib cage or right in front. Rib cage is here, and then in the front is here. So you're just going to rest it down for now. So the actual pose is you're going to take your long arm first and reverse your palms down and gaze to your tip of your nose. So you can drop your chin, or you can drop your chin, or you can drop your tempo down for now, but you need to make sure you have breathing appropriate here. You're going to reverse the same thing with the other hand and bring it down. And now take your nose off the floor and just lift up a little bit. So a lot of the times people with chronic back pains, this is very intense and very painful. So you want to do it in increments of small baby steps. So basically just want to float your shoulders and release it away from the ears and shift it back and keep your feet and your internal thighs inward together. And relax when you feel tired. You could change your neck to right side or the opposite side. Little by little, you're still pressing the hand down on the floor with reverse palms facing up. You want to lift up a little bit more of your chest. Keep your toes still down on the floor and just lift up one leg. Point, 1, 2. Lift up your thighs, 3 if you can. Sometimes it's hard, so you'll be here. 4, 5. You want to point your toes and you want to rest right down. And then again, inhale, lifting up. 1, shift your shoulders back. 2, point your toes. 3, you can lift up your head higher. 4, and again 5. You're releasing a lot of the tensions around the back, especially with kidney, UTI, gallstones, kidney stones, chronic back pain, sciatic, acute, whatever it may be, pinched nerve. This really, really does help, and that's why it's known to be a therapeutic practice. If placing your hands is so hard for you, you could shift your hands to the side, and then you could press your sternum first and keeping your toes down. So again, you're just leaving your toes and gaze down to your tip of your nose. One at a time, you're going to lift up again, pressing your palms down. And don't give up, it's going to be intense. And then again, other side, point your toe long ways. And then again, release and head down. So each of those poses, usually 5 breathing in our poses, and they're known as Shalabhasana A and B. So the first one you hold up for A with the reversed palms, and then the second time you place your hands to the side of your rib cage, and then you lift up your feet and your thighs off the floor, and then you do your best to hold the pose. So again, if it's too difficult for you in the beginning, what you can do is also take your hand in front and just kind of pressing. If that's too much, take your elbows down and just do a baby cobra, just looking up here. Or Sphinx. And then little by little, move your palms a little bit. Ooh, you can feel that intensity. Open your hands wider if that's too much for you. The eyes of your elbows are facing upward. So you again, relax your shoulder. Some people will like to drop their head back. Does not need, it's not necessary, just relaxing. And then again, relax the belly down. As you're getting better and better on that, move your hands even more closer to the body and relax the shoulder back. And again, you can feel all that. Okay? So let's put it together. Let's give it a try. Place your head down for a moment. Reverse your palms. So Shalabhasana Locust pose for 5 breathing. Inhale, both feet up, your toes are together, and your chest, it's going to be like that. Your head and your toes are height at the same place. 1, hold it. 2, breathe. 3, breathe. 4, breathe. 5, relax it down. Some people will put their head down to relax, others will keep their sternum up. Bring your hands to your rib cage this time. And now lift up the feet again and float. 1, 2, 3, 4, and 5. And again, usually there's an up dog, so your hands will be by your breastplate. Cobra would be yours, or you can roll back and up dog, just to relax your spine. So the other thing that I like to do to open up the back is I'll place myself on the wall. And what I'm going to do, there's a wall here. I'm going to lay my belly down on my nose as close as I can get to the wall. So again, I have to move close to that wall and slide and slide. I'd like to take my belly, my pelvis, actually my pubis, and reach, holding the wall. You can hold the wall. You can hold the wall. This releases a lot of sciatic pain. You want to have your head up. Just melting here. Holding. When you're ready to let go, you want to push like you're just going to go to upward dog. And then you can always take your child's pose forward with your knees apart, head down, and relax your sacrum. Your tailbone goes down towards your heel. Your head is on the front. Your arms are wide open and head down. And if you have somebody that can push you down, usually you press this downwards. So that's some of the ways that I like to open up my intermediate with Shalabhasana, the locust pose, and it really truly does release back pains. I've been doing this practice. I remember I used to wake up with them long time ago, and now it doesn't even come as when I, think about it. I haven't had one for a long time. I guess just because of the daily practice, when you're arriving to the rituals, just something that you do in a habit every day, then it truly does become medicine. Complementary, integrative medicine. Aloha, hope that helps you. Enjoy Shalabhasana. Namaste. Peace.